Hello and welcome. So today we're going to talk about the NHI, the National Health Insurance. What is it? What is it about? How does it function? How does it benefit the people? Let's talk about it. So the National Health Insurance, the NHI, is basically a fund that the government plans to utilize in order to pay for healthcare services for all South Africans to healthcare professionals that are both in the private and the public sector. This is to ensure equal and quality service of healthcare for all South Africans. So basically what this means is you can go to any hospital that you choose, whether public or private, and they will both function the same way for free, kind of. So with this bill, they want to ensure equality for everyone, all South Africans, regardless of your socioeconomic status. They just want to ensure that there's equality in the quality of service that all South Africans get for healthcare. This is to try to neutralize the whole I can afford this, you can afford that. They're trying to neutralize that. That's the aim. So the aim and objective of the NHI, according to Parliament, is to, and I quote, to provide universal access to quality healthcare for all South Africans. Obviously, we know the right to access to healthcare services is a fundamental right. And if you know, you know, but if you don't, I'll tell you, all fundamental rights have to be met by the state, but they have to do this according to available resources. Okay, so the question that I have is, do we have the resources? Do we have the available resources? As the state, do we have the available resources to fund this? Or are we just robbing people of their hard-earned money to make up for our own incompetence? So how will the NHI be funded? It's obviously going to be funded by general taxes, which is obviously going to mean an increase in tax payment, but also it's going to function like the UIF. So you know how in your workplace, you as the employee, you have to contribute towards the UIF, and your employer also has to contribute a certain percentage to the UIF. That's how the NHI will work as well. Both the employer and the employee will have to contribute a certain amount towards the NHI. So you'll have to pay for the NHI. Whether you want to or not, you'll have to. The financial aspects of this are very shaky. It's shaky ground, you understand? Because it's obviously going to cost the government an arm and a leg, and they don't seem to have a good grip on how they plan to do this. They can't provide an actual financial structure as to how they will implement this. And that's very alarming. So the biggest source of confusion where the NHI is concerned is, are they trying to override medical schemes? How are medical schemes going to function with the NHI in place? And these are all very valid questions. I have the exact same questions, okay? Very valid. Because make it make sense. Financially, make it make sense. Why would I, as an individual, want to pay 31% of my income towards tax, right? And then have to make NHI contributions and still pay for a medical scheme when I can get the same services and the same quality of services as anybody else, and they get them for free? Why would you want to pay for something that you get for free? It does not make sense. So I don't see this being, I don't see the necessity of the NHI. I'm not gonna lie. I don't see why it's necessary. I don't see it being a good thing for the people. I don't see it being a good thing for health providers, because they're all basically going to be funded in the same way, and they'll obviously be funded the same amount of money. Why? It's not necessary. And I don't see it being good, especially for healthcare providers that are in the private sector. They've chosen to work in the private sector. Why does the government want to monitor how much they make? It just doesn't make sense. The logistics of this whole thing do not make sense at all. I don't think it makes sense. Personally, this is just me. I don't agree with it. I don't think it's necessary. I think there's so many other things that they could use the time and the resources towards to try to better other aspects of our country. And this is not one of them, not now. There's no need to try to work on something that's already in place when there's still so many other things that have to be worked on first, you know? So I think they're just focusing on this to try to deviate from the actual pressing issues that they need to deal with. That's just what I think. So the NHI bill has already been passed. It was passed sometime last year. And if you crunch up the numbers, I think it was supposed to be passed in 2026. So what's the rush? Why rush to pass a bill 3 years earlier than you can implement it? I mean, I understand. I know how the law is made. So I understand that, it's very seldom that a bill will get passed and implemented like in the same year. It usually takes a while to implement a bill. But I don't understand. What's the rush? What's the rush in in passing a bill that you can't implement until the next 3 to 4 years? Doesn't make sense to me. It never will. I don't know, but I think it's just an election tactic. I think a lot of things that happen now up until the elections will just always be election tactics. I think that's why they were in such a rush to pass the bill, so they can try to like rile the people up and be like, oh, we're passing the NHI bill, and you already know what that means. Basically, sort of like free healthcare for everybody. It doesn't make sense, and it's just an election tactic. They surpassed my expectations by passing it. I didn't even think it would get passed, at least not anytime soon. But it has been passed, it just hasn't been implemented yet. And I don't know, I think there's still a long way to go before it would get implemented. But I don't know. I'm one of the people that were like, oh, they're not even going to pass this bill, and they did. So we'll see, but I genuinely think it's just an election tactic. Anyway, so that is it for now. Thank you so much for watching. Please don't forget to subscribe. Give the video a thumbs up, like it, and comment. Comment down below, and let's chit-chat. I love to chat. Okay, so let's talk. Let me know in the comments what you think about the NHI bill. Is it even necessary? I feel like that's the biggest question. Is it a necessary thing to do in this here country right now? I don't think so. But let me know what you think.
News and react.